Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nick Nickham. I am a cardiologist from Houston, Texas. In this presentation, we are going to look at empagliflozin for heart failure with preserved ejection fraction in terms of benefits. What are the benefits? And we are also going to compare a different study which looks at the cost versus benefits ratio. So let's begin with this article which was reported in the circulation titled Emperor Preserved Trial, which looked at the effect of empagliflozin in patients with heart failure with the preserved, you can follow my arrow here, with preserved left ventricular ejection fraction with or without diabetes. It's a pretty big study. Their objectives were to look at, does empagliflozin improve heart failure in terms of admissions, recurrence, or death? Does it work in patients with preserved ejection fraction? That was the next question. And finally, does it have benefits in non-diabetics as well as diabetics? So let us see what the results were. This study comprised of almost close to 6,000 patients. They were divided into empagliflozin 10 milligrams versus placebo. And here are some of the things that are charted here as far as the primary and secondary endpoints are concerned. Here, cardiovascular deaths or readmission for heart failures were uniformly shown to be benefiting in patients with diabetes and without diabetes. Similarly, the recurrent hospitalization also showed improvement in diabetics and also non-diabetics. And of course, this is the first heart failure admission. And when you come down to cardiovascular death, there was no significant difference. When it came to all-cause mortality, there was no significant difference. When it came to renal endpoint in terms of worsening renal function due to diabetes, there was no significant difference in the treatment group versus the placebo. And if you look at the Kaplan-Meier curves, patients treated with empagliflozin who are diabetic, their heart failure admissions dramatically dropped, the primary admissions. And similarly, in non-diabetics, they saw a similar improvement in the heart failure readmissions, primary admissions or death. Whereas if you look at the recurrent hospitalizations for heart failure, and again, we saw a significant improvement in patients treated with empagliflozin in both diabetics and non-diabetics. So that's the benefit we saw. And when this was plotted against the hemoglobin A1C, as we can see, throughout the wide spectrum of hemoglobin A1C from 5.0 to 10.0, there was some benefit for heart failure patients who were treated with empagliflozin, which was more evident in the groups that had hemoglobin A1Cs less than like 7 to 8 compared to those who had hemoglobin A1C levels like 9 or 10. As far as worsening of the renal function, there was no significant difference in the empagliflozin group compared with the placebo over the study duration as far as decrease in renal function. With diabetes, of course, there was a slightly increased worsening in patients with diabetes, which is probably expected, than in patients without diabetes. These results sort of summarize the outcomes of this almost close to 6,000 patients who were randomized to empagliflozin and placebo, showing reduction in the number of primary hospitalizations and recurrent hospitalizations in both diabetics and non-diabetics. However, there was no improvement in cardiovascular mortality or overall mortality in this study group. Here's another study which looked at the cost effectiveness of empagliflozin in patients with heart failure with preserved ejection fraction. They looked at the data from the same study from a different perspective, and this is what they came up with the cost. But before we get into, we have to understand what is the cost of empagliflozin. If you don't have a prescription plan, this is what the retail cost is, approximately $550. If you have a prescription plan, even with Medicare deductibles and all this, it will still come to approximately $337 per month. So let's keep that cost in mind. And keeping that cost in mind, their observations were that in this economic evaluation, using a Markov model based on the Emperor Preserved trial, a population of 5988 patients, empagliflozin had incremental cost effectiveness ratio of $437,442 per quality adjusted life year gained. The results were most sensitive to the monthly cost, quality of life benefit, and effectiveness of cardiovascular mortality of empagliflozin. There was no change in mortality as we saw, and there was a small improvement in the quality of life at a significant cost involved to get 1 year of quality adjusted life year. So the conclusion was findings suggest that empagliflozin provides a low economic value compared with standard care of heart failure treatment for patients with preserved ejection fraction, largely due to the lack of mortality benefit and a very small benefit in quality of life. So when you are treating patients with heart failure, with preserved ejection fraction, with diabetes or without diabetes, keep in mind the cost of drug. Even with all the prescription deductions, it can be substantial, especially in non-diabetic patients. So, ladies and gentlemen, thank you so much for watching this presentation, and please do subscribe to our YouTube channel. We have numerous presentations on many cardiovascular topics. Please do watch them, and I will see you in the next presentation.